Okay, welcome. We're so honored to have Dr. Stern with us today from the ASPCA to talk about this truly important topic of toxicities and other problems affecting birds. She's been with the ASPCA for 15 years and is now the Associate Medical Director. So I'm sure she's seen it all. So I'm glad you're here today because the more we learn, the better we are at preventing those problems. So I'll see you at the other end, Dr. Stern, and thanks again for being here. We're very grateful.
You are very welcome. I'm very honored to be here and discussing with this group common pet bird toxicities. Just to let you guys know, I am double boarded in toxicology. A member of the American Board of Veterinary Toxicology and the American Board of Toxicology. So I know my toxins. I am a huge bird enthusiast, but I don't know that I would say that I'm a huge bird expert. So if there's something that you guys ask me that I don't know, I may need to look it up and get back to you. So that being said, I know we have a very diverse group today. We've got some veterinarians, we've got some pet bird owners, we've got some rescues, that sort of thing. I'm trying to make this discussion accessible to everybody. So I will be happy to explain anything that wasn't clear in more basic terms or go more into depth if people want more in-depth information. So just let me know what you're interested in, and I'll be happy to do that as well. All right. So first off, just talking about birds in general, do they get into things that they shouldn't? Hopefully that gives you a little bit of a laugh. I know everybody here probably has birds and knows that the answer is an overwhelmingly yes. They are very naturally inquisitive by nature. Birds love to get into things. They love to explore their environment with their beaks. And at the ASPCA Poison Control, we've had over 3,000 cases involving pet birds just in the past 10 years. So we do get lots of calls about birds getting into things that they shouldn't. Kind of a fun fact here. The youngest bird that we had a call about was a group of Quaker parakeets that were only a few days old. And the oldest bird we've had a call about was a 60-year-old yellow-crowned Amazon parrot. So, regardless of their age, they can be a little bit naughty and get into some things that they shouldn't. So, one of the nice background things is to look at how birds are commonly exposed to toxins. The reason that this is the most important is if we know how birds get into things that they shouldn't, then we can help prevent that because ultimately my ultimate goal is to prevent anybody from getting into anything that they shouldn't. That's my dream job. I would love to put myself out of business and have no pets that are ever exposed to any toxins ever. That's my dream. So we've said birds explore the world with their mouths. So when they come across something new, when you give them a new toy, what's the first thing they do? They go over and they start mouthing it. They want to explore more of it. So that's kind of their default. They're going to do that. So a lot of times that will lead to misadventures on their own. They're like, oh, hey, what is this bright shiny thing? Oh, it's a pill. But sometimes this is also inappropriate things that are given to them. So people don't know that avocados are toxic. They'll give them a piece of avocado and they'll eat it, and we'll see issues with that. They're going to have things in their environments, like, we know we want to stay away from any kind of enclosures that have galvanized wire. The galvanized part of that is zinc, and we can see zinc toxicity from those birds. So we want to make sure that what we're giving them is safe. We also can have inappropriate medications that were administered to them. I always feel extra sorry for these birds because they really didn't do anything wrong. They just got either the wrong dose or the wrong medication that was administered to them. So we always want to make sure, even if we're giving something over the counter, that it's not going to be a problem for our birds. And then the last thing is inhaling things that are in the air. So any kind of aerosols or anything like that that's in the air. We know birds are very, very sensitive to those. So we want to be very, very careful about what they're breathing in. All right. Why are birds special? And here I'm talking about in regards to toxins. We all know that birds are really, really special. They're amazing pets. Um, But as far as toxins go, they behave, their bodies behave much, much differently than like cats and dogs or livestock or anything like that. So, you know, most of our patients don't have wings or beaks or crops or gizzards or cloacas or anything like that. So this is going to present some exciting challenges when we're dealing with toxicities. And one of the biggest things that makes birds special is they have a very efficient respiratory tract. Their lungs work much, much better than ours do. They are very efficient at exchanging gases, which is fantastic when you need a lot of oxygen because you are using a lot of oxygen when you have to fly. It is less awesome when you are breathing things in, breathing toxins in. Those toxins are going to be absorbed by the lungs much, much more quickly because birds are so good at exchanging those gases. There is also a lack of data about how toxins affect birds. This is kind of a double-edged sword. One, sometimes I'm sad we don't have data. I don't always know how birds are going to react to certain toxins because we haven't exposed birds experimentally to those toxins. The upside of that is we haven't exposed birds to those toxins, which makes me very, very happy. I don't ever want to see experimentation on animals when we don't need to, but sometimes that means when we're treating toxins with birds, we don't know exactly how they're going to react, and we have to look more at the bird and treat our patient that's in front of us. So a lot of times this is going to mean that we need to monitor these patients very, very closely, whether that be at the vet hospital or at home, to catch things very, very quickly because we know that birds are very sensitive and things can escalate very, very quickly with them. They have unique sensitivity to toxins. They react to things that other species don't, and we're going to talk about some of those kind of as we go along. On the flip side, there's some things that birds don't really react very strongly to that other species do, so that can be a really good thing as well. Birds are also very, very good at hiding signs of toxicity. We know that they're really good at hiding signs of being sick or diseased or anything like that. Same thing goes with toxicity. A lot of these birds are going to be prey species, and if they show weakness, they're going to be at risk for being preyed upon. So they are going to hide those as well as they can, which can be difficult when we're trying to catch things early before they're actually becoming a big problem for these birds. And then we have differences in toxin ingestion too. This sounds kind of odd. What do I mean by this? So we know that dogs in general are gulpers, all right? If they see something they want, they are going to try to get it into their mouths and down into their stomachs as quickly as possible. So they are just going to gulp things down. They're not going to chew them very well. Cats tend to be chewers. All right, so they're going to nibble on things, decide if they like it, and then go about that way. But birds are very, very special. Birds do something, and this is my own personal thing, but I say that birds tend to Cookie Monster things. When I mean that, if you've ever watched an episode of Sesame Street, you've got Cookie Monster here, who is a puppet. Hope I'm not spoiling that for anybody. But he will eat things like cookies and that sort of thing. He doesn't have an esophagus or anything like that. So essentially, all of the cookie pieces fly out of his mouth. A lot of times birds will do that. They are more interested in kind of making a mess than actually eating what they're doing. They're exploring, they're experimenting with texture and that sort of thing. They're not as interested in eating this. This can be really advantageous. Sometimes we'll have birds that have gotten into medications or other things, and they've actually, on paper, ingested a lethal dose, but we will find pieces of this everywhere, and it actually turns out that they didn't really get much or any of this. And sometimes these birds actually won't show a lot of significant signs, which is one of the reasons it's so important to monitor these guys. All right. I am going to um, address chickens really, really quickly. Okay. You may notice that there is a beautiful chicken that is on this slide. This is really the only place I am going to address chickens in this presentation. I know that chickens are beloved family pets. I have several relatives who have chickens that will just lay in their arms like babies, and they are lovely, lovely to work with. But we are largely in this presentation going to focus on pet birds other than chickens for a couple of different reasons. Um, they have different concerns due to their environment. Most chickens are going to be outside. They're going to have different toxin exposures. We also have concerns for chickens. A lot of chickens are going to be kept not only as pets, but they're going to have that lovely fringe benefit of giving us eggs to eat. And we have concerns if they get into a toxin about egg consumption as well. So the third thing is that chickens are technically considered to be food animals, even if we are not eating them as food animals, even if they are pets. So there are extra regulations around treatments of chickens and what medications you can and cannot give them. So one thing that I will tell you, and this is my pro tip for chickens, if you have a chicken that is planning to be used for meat or eggs and they are exposed to a toxin, I would highly recommend contacting FARAD. FARAD is a government agency. It's the Food Animal Residue Avoidance Department. So they can tell you if you have a chicken that's been exposed, when can we start eating the eggs and that sort of thing? Like when is it safe so that we don't potentially put our family at risk? And this can be a big issue for things like lead or even if they get into, medications or anything like that. All right. So if you think that your pet bird has gotten into something, one of the first things that if you call the Poison Control Center or if you take them to your veterinarian, one of the first things they're going to do is they're going to ask you a whole bunch of history taking questions. Okay. Just as an FYI, kind of a fun thing, this picture here, if you ask ChatGPT to tell you what a bird veterinarian looks like, this is what they tell you that a bird veterinarian is like. All right, so those history taking questions. The first thing that we're going to ask is, what did your bird get exposed to? What did they get into? And we need to be very, very specific because there can be a lot of different concerns based on ingredients and active ingredients, and those aren't necessarily the same. So if you tell me your bird got into toilet bowl cleaner, we might see anything from just some mild indigestion, they get a little bit of a sour stomach, to seeing like burns in their mouth and their esophagus and needing to be hospitalized for treatments and that sort of thing. So we want to be as specific as possible. If you take your bird into the vet, make sure you bring all of the packaging for whatever they got into with you. I would tell you that I would put it in a special container to prevent any kind of accidental exposures on the way in. Most of the time, our birds are going to be in a secure enclosure, but unfortunately, a lot of times with dogs, we've seen that they're super excited about it getting into the chocolate or the pills or whatever, and they are happy to get into that in the car as well. So when you speak to a veterinary professional about this, what they're going to do is they're going to go through and they're going to examine all of the ingredients that are in this. And this includes things called inactive ingredients. If you look at medications on the back of the labels, and this is something I never did before I started working at Poison Control, and now I do every time I get something. A lot of times it'll say active ingredients, and then below it'll say inactive ingredients. The reason it says inactive ingredients is that's things that have been deemed not to be a concern for people. But sometimes it is a concern for other species. One of the ones that I always talk about is xylitol. Xylitol is listed as an inactive ingredient. It is definitely not an inactive ingredient for dogs and maybe birds. We'll talk about why it's maybe birds. But it can cause things like low blood sugar, it can cause damage to their liver, that sort of thing. So just because the FDA says it's not a problem for humans doesn't necessarily mean it's not a problem for our veterinary patients as well. Right? The next question we're going to ask is, how did this happen? Okay. So a lot of times we want to answer the question, what were the circumstances of the exposure? This is just a fancy way of saying, can you tell me what happened? And asking a lot of open-ended questions like this are really good because pet bird owners, you guys have a lot of information that you may not know that you actually do. So if you have to describe what happened, a lot of times I can not only get a lot of information very, very quickly about what happened, but I can get a list of follow-up questions that I want to ask you as well, because I know that you have this information. So we're going to ask you, how did this happen? Is this something they inhaled? Is this something they chewed on? Is this something they rolled in? How did they get into this? And explaining how it happened can also help us determine the amount that they may have gotten into as well. So we know, like I said, the birds cookie monster a lot of things. And if they cookie monstered a pill and you say, hey, there's a bunch of powder on the counter where they got into it, I know that they didn't get that full pill or that full capsule. All right. So we might have you compare the amount of capsule or amount of powder that is on that counter, like sweep it all up into a little pile and open up another capsule and put it on there and see, like, does it look like it's about the same? It's like a quarter of it missing. And that's so much more helpful than just saying, well, we could have gotten into one whole pill. All right. So sometimes we won't even know how many pills they got into. The container was left open. They decided to play with it. If you have a big bird, they may have gotten into the childproof container on their own. I've definitely seen that as well. So we may ask to count pills backwards. This is especially helpful for like prescription medications. You can tell me when it was filled. You can tell me how many times a day you take it. I can tell you how many pills should be in there, and then you can count back and see how many pills should be left. So, are there any pills left? If there are, I'm going to have you count those pills. How many pills do we have left? At the very least, we can see how many were in there to start with and how many were left. Sometimes we'll have pet owners call and they're like, this prescription is 20 years old. I have no idea how many were in there, but there were 14 to start with. And then we count out the remaining pills and there are 12 left. So I know the most we could have gotten into was two. If there's any kind of a liquid, was there a puddle of this liquid? Was there a little bit of residue? A lot of times, if there's just like a very small amount, the residue isn't going to be nearly as much of a concern as that they could have gotten into the puddle. This can be really difficult to assess how much they could have gotten into, but a lot of times if you think hard about it and if your vet is able to ask you some kind of insightful questions, we can come down and really narrow it down into how much they could have gotten into. This is really, really important for us predicting how severe the signs are going to be. Sometimes we can avoid all treatments altogether. It looks like they just got into a little bit of the residue. Let's watch them at home. If we see XYZ, then we're going to go ahead and take them in. But we know that no treatments are benign. So we don't want to undertreat our patients. We don't want to say, oh, it's probably going to be fine, and then have them develop really severe signs. But we also don't want to over-treat our patients either. Just because birds get stressed, we don't want to put them through that. There's a cost associated with that. All of these different things, I don't want to go either way, either under-treating or over-treating them. Another of our history taking questions, when did this happen? If you don't take anything else from this webinar, I am going to give you this tip. make sure you write down what time this happened. Time will slow down as soon as you notice this happen. It is not uncommon for pet owners to get to the vet and the vet says, yeah, the owner said this happened about 5 minutes ago. And we'll be like, they actually called us 45 minutes ago. Things will slow down, things will stop moving, and it will seem like a lot less time has passed than it actually has. So, did you see this happen? Did you catch your bird chewing on a tablet? Did you catch them licking coffee out of your coffee cup? I've definitely seen that before. Um, Or is there a time frame? Time frames are really hard. A lot of times we'll have pet bird owners, they call in and I'll say, hey, what time did this happen? And they'll be like, I have absolutely no idea. Most of the time that isn't true. You have a lot of information, a lot of very important information that you may not know that you have. So when we talk about this, we'll be like, when was the last time you saw this undisturbed? And you're like, oh, I made my coffee at 8:30 this morning. Great. When did you notice that the coffee cup was dumped over and that, your bird had probably been licking this? Oh, 11:30. I now have a super great time frame. I know it happened sometime between 8:30 when you made this and 11:30 when you noticed that the cup was knocked over. Also with time frame, would there be any times that your bird would not have had access? Were they in their enclosure, closed into their enclosure that they wouldn't have had this? Were they in a room with you the entire time? Were they in the bathroom with you while you took a shower? Anything like that. Are there times where they couldn't have gotten into this? That can be very, very helpful as well. And then another question, when did signs start? And how have they progressed? Okay, so what time did you notice that they were showing signs? If they are showing any signs, a lot of times we'll get them and they're like, they're totally normal. That always makes me really, really excited because I have more options for treating them if they aren't showing signs yet. If they are showing signs, that's fine too. We can deal with that. But if they are showing signs, when did they start? Have they gotten better? Have they gotten worse? Have we started to see new signs? Try to think about all of these things, and it's really, really hard because this is a very stressful thing. One of the things we're aware of when we're talking to people, they are typically really, really stressed. This may be one of the worst things that's ever happened to people, and we are definitely aware of that. And we ask lots and lots of questions because a lot of times you will know a lot more than you think you do, especially if you can take a breath and think about it and really, really can help your bird out a lot. So, when were they last normal? Even if we don't know exactly when they started, last night my bird was totally normal. This morning they're showing signs. And then also keep track if you've done anything to treat this at home. Did you give them any medications? Did you do anything to try to decontaminate them? Have you gotten advice from Dr. Google or any kind of online forums or anything like that you've done? One of my pro tips in general, don't do anything until you get advice from your vet. As long as your bird isn't in a dangerous situation, don't do anything until you've talked to your vet. Get advice immediately. If your vet is not available, talk to an ER, call poison control, but make sure that you get advice right away and you don't do anything else. Sometimes we can see complications from other treatments if people have given their birds medications, anything like that to treat things. And you can see this little birdie is trying to get advice from online forums too. And then we're probably going to ask, does your bird have any medical conditions? Are they on any medications? Are they taking any supplements? This is very basic medical history that you're probably going to get asked no matter what. But it's still really, really important to ask this. Some medical conditions can make them much more sensitive to toxins. Some medications can interact with other medications or the toxins, that sort of thing as well. So we want to make sure that that's going on. A lot of times we'll ask about exposure to infectious disease. Sometimes what they got into is kind of a red herring. It's not necessarily a big concern for them. but it can be more of a concern that there's something else that's going on. So we want to make sure that we don't miss anything. What's their environment like? Is there anything else that could have been an issue? Do you have ceiling fans going on? Could we have seen trauma? That sort of thing. Are they caged? Are they out all the time? Are they free roaming? Can they fly? That's another big one. Do they have their wings trimmed? Can they just kind of go wherever they want? And then last, asking about diet is really important. We can make sure we don't have any nutritional deficiencies. I am sure everybody here is really, really on this, but we know sometimes new pet bird owners might have some challenges. And then we'll ask about basic husbandry too. All right. And then finally, with our history taking questions, we'll ask about other birds. Okay. And sometimes this can be a little bit counterintuitive. I'm very concerned about this bird. Why are you asking about other birds in my home? I know that pet bird owners often have multiple birds because they're like potato chips. You can't have just one, right? So we want to make sure we're not leaving anyone out. We are going to ask if other birds could have been exposed, even if they're not showing any signs, and this bird is showing signs. We're going to ask even if they wouldn't do something like this. Oh, this bird's usually really well behaved. I wouldn't expect him to do this. Even if this bird only got a little bit and the other bird got a whole lot more, we still want to know about that other bird. And if we have something that they could have inhaled, I absolutely want to know about other birds, even if they weren't in the same room. The reason we want to know about other birds in the house is sometimes we'll get very specific airflow patterns. We're going to talk about Teflon toxicity later on. And sometimes you'll have birds that are in the same room or like in the next room, and they won't show any signs. But it's the bird that's down the hall that has issues. And sometimes, depending on the airflow in your house, sometimes all that air from the kitchen will get pulled down the hallway all the way to the end of the hallway. It's the bird that's in the last bedroom that shows signs. So we're going to ask about all the birds just to make sure that everybody's okay. Sometimes if we suspect a certain bird, that's totally great. You guys know your birds better than anybody else. They usually wouldn't have done this. What we will do is we'll actually tailor our recommendations and our treatments based on that suspicion. I'm going to be a lot more aggressive in how I watch this bird that we're pretty sure got into this versus the other birds. I might do treatments with them that I wouldn't do with the other birds because we don't think. But it is really, really important not to completely rule out those other birds based on personality or even finding the bird with this. Sometimes everybody will take part and you will find the last bird who happens to be the guilty culprit. We'll also ask, are there any other birds that are affected? This bird's showing the worst signs, but there are other birds that are showing less bad signs, even if they're very mild or they're not the same as what this bird is doing. Sometimes toxicities can prevent different ways in different birds. All right, that's the basics of the history taking and why we're going to ask you so many questions. Hopefully, you never have to deal with this, but if you do, hopefully you'll know why we're doing that. So we are going to talk now about decontaminating our patients. So best thing to do with toxins is that they never get into it in the first place. Second best thing is that we prevent them from ingesting it or absorbing it or anything like that by decontaminating them. So if they get something on their feathers or on their feet, we may go ahead and do some dermal decontamination. So for some birds, if they have a very small light exposure on their feathers, we may go ahead and mist them with a water bottle. Okay. Sometimes this can be very, very effective at getting off a little bit of something with them. Okay. I do say we might be able to do this. Some birds, and I'm sure nobody does this here, but some birds are used to having a water bottle as a punishment. I know we have a lot of rescues. I know we have a lot of people who have rescued birds. So you may have had birds that experience this as a punishment before. So we don't want to stress birds out if they see this as something negative. I know a lot of birds do like to be misted, and if they do, fantastic. But if it's really going to stress them out, we don't want to necessarily do that for them. If they have a heavier exposure, so they're soaked in this or anything like that, we will go ahead and give them a full bath with dish soap. And when I'm talking about dish soap, I'm talking about our liquid dish soaps, something that we'd use to wash dishes in the sink. We want to make sure that we only use something like Dawn or Palmolive or something like that. And the reason why is a lot of the things that we will use in the dishwashers actually contain something called cationic detergents. And what cationic detergents do, and you may have heard people say that your dishwasher actually works better if there is food on them. That's because cationic detergents dissolve organic material. Okay. You, me, and our bird friends are all organic material. So if we bathe them with something that is supposed to go in the dishwasher, we can actually cause burns to their skin. So we never want to do that. So we want to do something like Dawn. If they've got the little ducky on the label, when they're talking about saving oiled birds, that's something safe to use on their birds. So if they've had a really heavy exposure on their feathers, we may recommend that. We're going to recommend that early on, and if only if they're not showing other signs. I don't want to take a bird that's already feeling stressed or sick and stress it out even more. But if it's been a recent exposure and they're bright and happy and just happy that they got to be naughty, then we will consider going ahead and giving them a bath. And you can do that a lot of times right in the sink. If you have a bird that's not amenable to that, you can also take them into the vet hospital and have them go ahead and bathe the bird as well. One of the big things, if we do bathe them, birds are very susceptible to chilling, so we want to make sure that we keep them warm after the bath. One of the best tips I have for this is to use warm towels. So I will take a whole bunch of towels, I will warm them up in the dryer, and I will take a towel out of the dryer. I'll keep the dryer going with the other towels. I'll put the nice warm towel on the bird, and then I'll switch it back out as it starts to get cold or wet or anything like that. So they're always nice and warm and snuggly. And I have to tell you, it is my dream someday that somebody is going to do this with me. Just keep me like wrapped in warm towels. And they start to become a little bit less warm, they're going to switch out another one. This just sounds like a really wonderful thing to happen. If they're at the vet hospital, vets often have a device called a bear hugger, which just surrounds them in warm air, which also sounds like sleeping on a cloud. But we want to make sure that these guys don't get chilled. We can cause a lot of issues if we see that. All right. Now, what if they get something in their eye? We want to make sure that we rinse that out of their eye as well. So we can flush their eyes with a number of different things. You can use, if they're at the vet hospital, you can use eye irrigation solution or normal saline, which is what's used in IV fluids. If they're at home, you can use tap water as well. That's an okay thing to use. A lot of times we'll take a cup or an eyedropper, or if you're in a vet hospital, you can use an IV set without a needle. And we are going to run that over their eye. If they have gotten something into their eye, most of the time we're going to do that for about 5 to 10 minutes. If they got into something particularly irritating, so like I was talking about that, those dishwasher packs, we are going to flush their eyes for 10 to 20 minutes, which is a very, very long amount of time. So if we have to rinse their eye for that long, a lot of times we'll consider doing that at the vet hospital where we can give them a little bit of sedation just to make them more comfortable because I think that's going to get really, really stressful after a few minutes. Or we're going to flush their eye and give them a little bit of a rest and then flush their eye again just to minimize stress. We really, really want to avoid stress in birds at all costs. Right? So if they've eaten something that they shouldn't, We're going to talk about decontamination as well. Most of the time, if birds have eaten something, we're going to have to do decontamination at the vet hospital. That's going to be something we're going to have to bring them in and have your vet see them for, with one exception. If they've gotten to something that's a little bit irritating, we can potentially give them what we call dilution to help dilute it out. Okay. So one of the toxicology sayings is dilution is the solution to pollution. You may have heard this before. The more dilute we can make something, the less irritating it is likely to be. So how do we do this? First thing, we pick something that is a treat. Okay. Um, this is often a challenge. I can't say give every bird this because we know that our birds have different diets. They have different things that they like. So here's some suggestions. We can give them a dairy product if you have a bird that really likes yogurt or something like that. Most birds aren't a super big fan, but we can give them that as long as they don't have any artificial sweeteners in there. We can give them juicy fruits or fruit juices, like things like oranges or strawberries if there's something they really like. We can give them vegetables. Cucumbers are really great for this. Something that's really juicy is a really, really good choice. And depending on the size of the bird, we'll give anywhere from about a half a teaspoon to a tablespoon. So you want a couple of mouthfuls, just kind of as a rule of thumb. If we do need to take them into the vet hospital, and this is not something we can do at home, we could potentially do crop lavage with them. Obviously, we can't do this at home because they need to be sedated or even fully anesthetized to get this. We will place an endotracheal tube to protect their trachea so they don't inhale any of this into their lungs, which is a major complication for birds, and we don't want to happen. And we will take body temperature saline, so we don't want to chill them or have them get burned because the fluids are too hot or anything like that. We'll flush it into the crop and then we'll aspirate it back out. This is kind of like if you've ever heard of anybody going to the hospital and getting their stomach pumped. It's kind of like that for birds. We can't use this with a number of toxins because it can potentially make things worse. So always good to take a full history before you get this. And then we can potentially give something called activated charcoal. This is different from what you would get like over the counter. This is going to be something that's medical grade. Dosing for birds is not well established, but what this can do is it can actually bind the toxin while it's in their stomach or in their intestines and prevent it from being absorbed into their circulation. We don't have a great dose established for birds. Oiled birds can get activated charcoal, and they suggest doing just 52 milligrams per kilogram. With dogs and cats, we give about a gram. Most people for toxins kind of go with that dog and cat dose as well. Um, you have to keep in mind crop volume with these guys. If we overfill their crops, they can potentially regurgitate the charcoal, which is really not something we want to have happen because they can potentially aspirate that. So sometimes we can't get to this gram per kilo dose based on how small their crops are. All right. This is my favorite one because everybody's about to become an expert in how to decontaminate their birds if they've gotten into something that they inhaled. You move them to fresh air. All right. You move them away from what was going on. And remember, we talked about airflow patterns, so it doesn't necessarily mean you move them to a different area of the house. You move them out of that enclosure, out of that area entirely. So if we have potentially an exposure to Teflon or anything like that, they need to go out of the home. All right. With birds, we don't induce vomiting with them. We don't make them vomit because birds can't vomit and they may actually inhale this up into their lungs. This is my lovely, terrible drawing of a pelican potentially vomiting. We also don't give enemas because they're not very effective with birds due to their anatomy, and we can potentially contaminate their reproductive or urinary tract and cause more issues. All right, so that's kind of our background with this. Next, we're going to talk about specific toxins for birds. And the first one we're going to briefly touch on are some different plants that can be toxic. There are a lot of plants that can be toxic. This is definitely not an all-inclusive list. These are some of the most common ones that we get calls about. Some birds tend to really like to chew on plants, and the most common houseplant exposure we get are something that are called insoluble calcium oxalate plants. That's a mouthful, but this is going to encompass a lot of common houseplants. Not all of them, but a lot of tropical houseplants have this particular strategy to avoid being eaten. In the past 10 years, we've had 173 calls about birds that have ingested these types of plants. So very, very common. We see it happen a lot. One of the reasons we get a lot of calls about these is if you go and Google this online, they will say that these plants cause birds to develop low calcium in their blood, which can definitely be life-threatening, and also develop kidney failure. That's not true. That is true of something called oxalic acid. These are different than that. We'll talk about how they're different in just a second. But to let you know, the most commonly reported insoluble calcium oxalate plant exposures are things like pothos, philodendron, peace lily. If we have any plant experts, you will recognize these are very common house plants. Philodendrons, dumb cane, flamingo or anthurium, elephant ears, calla lilies, ZZ plants, and arrowhead plants. These are all very, very common house plants. And how these work, how they show signs is these plants, they can't run away. All right. So if somebody's trying to eat them, they have to stop them in some way. Some plants are poisonous. These plants have developed a different strategy, and they have these calcium oxalate crystals. If you look at these, the ends of these things are really, really sharp. They look like little javelins. They get packed in these things called raphides. And what happens is when they are chewed, the gel around them swells, and these little javelins come like spraying out. Okay. And they're painful. It sounds really bad, but it's actually not too bad most of the time. So, what we see with birds are usually some mild effects. Sometimes they can regurgitate, which is something we definitely take seriously. It's pretty rare. Sometimes they can have a little bit of pain in their mouths as well. In general, we're going to see signs happen within 2 hours of them getting into this. So it happens pretty fast. These plants want you to stop chewing on them right now, not 3 days later. And signs are actually super rare in birds. Most of the time, they're just kind of touching this with their beak and making little hole punches in it rather than actually chewing on these things and getting those crystals. So, a lot of times we'll do that dilution like we talked about with our juicy fruits and vegetables, and then we'll just watch them at home. And generally they do really, really well. Of all those cases, we have less than 10 that actually showed any signs. So most of the time, these guys do very, very well at home with, and saves you a trip to the vet there too. Another plant exposure that we want to talk about is marijuana. And we know a lot of homes with birds have marijuana. In a lot of places, marijuana is legalized either for medical or for recreational use. So this is something that we're getting a lot more calls about just in the past 5 or 10 years, although it's always been something we've gotten a lot of calls about. One thing we hear consistently from veterinarians is that they're seeing lots more severe signs than they did when they first got out of practice. And this is because THC levels have more than doubled in the past 25 years in plants that are commonly being used. So they are being bred to have more THC, so we do see more severe signs. So THC in plant material can go anywhere from like 1 to 24%. but it's the extracts and the oils that we get more concerned about. If you have hash oil or marijuana oil, it can be up to 50% THC. So those can be very, very high. We can see a lot more severe signs in those potentially. Now we know that THC can be really well absorbed via inhalation and also orally. So if somebody is smoking marijuana around a bird, we can actually see signs from that. And if they are inhaling smoke, we typically see signs very fast within about 6 to 12 minutes. If they eat some of the marijuana, some of the gummies, some of the edibles, whatever it is, the absorption in their stomach and in their intestines it's kind of erratic, and it is in most species too. We can see signs within about 30 minutes, but sometimes it'll take a couple hours for us to start to see signs. In dogs and cats, most commonly what we see is these guys are really tired. They can be kind of wobbly. They will pee all over the place. And sometimes they'll get kind of twitchy. And we can see some of these similar signs. Obviously, birds don't defecate all over themselves. They're a little more considerate than that, but they will be tired. They'll be kind of wobbly. You may notice them kind of stumbling around. They will get kind of twitchy with this. But they are a lot more likely to become very, very depressed, even to like comatose. They may have a very low body temperature. And then one of the big things is a lot of birds will regurgitate when they get this. About 35% of those birds. And 12% of our birds actually showed signs of having difficulty breathing. So when birds are having difficulty breathing, you may notice they're really puffed up. You can see their keels move a lot more. They may be open mouth breathing. They may be bobbing their tails, that sort of thing. Um, a lot of the time that they're having trouble breathing, it's because they regurgitated and they actually got the contents of their crop into their lungs. And this can be a really big deal. It can cause pneumonia in them. So this is a pretty major complication that we see with birds that we don't see with other species. So most of our cases of marijuana ingestion need to be hospitalized. We may consider doing a crop lavage. We may consider charcoal with them just because they do show so much more serious signs. They're really, really small compared to other species. They tend to get a really big dose. And then usually we'll watch them for several hours to see if they're going to show signs or not. We'll watch things like their heart rate, make sure it doesn't drop too low. We'll make sure we keep them nice and warm. One of the big ones is we'll prevent them from inhaling this stuff up into their lungs. We'll try to prevent them from regurgitating at all. Nice thing is we don't see a lot of differences in their blood work, so I'm not worried about them going to organ failure or anything like that. But sometimes their blood sugar gets low and we have to supplement that as well. Right. I do have a case to present, and I want to thank Dr. Lauren Powers at Carolina Veterinary Specialist. She went through this case with me and actually provided the photos for this. We presented this at Exotics Con before, but I just want to talk about this marijuana case because I thought it was pretty interesting. So we had a 4-year-old male white belly caïque who is about 155 grams, who's in really good condition, and they noticed that he got into cannabis resin. So what is cannabis resin? So a lot of times after cannabis is smoked through like a bong, there will be this resin, and this is like a kind of a black sticky material. Afterwards, that'll be present. THC in this is actually very, very high. And they noticed that he became very stuporous, so he wasn't really responding like he normally would. He was very twitchy, very overreactive to any kind of light or sound. If you put your hand near him, he would flinch away. So that's how he looked on presentation. Dr. Powers called me. We talked about this, and because He was actually pretty stable at this point. We talked about monitoring him. We talked about keeping him warm. We talked about watching him for signs to get worse. We did not do any kind of crop lavage or activated charcoal because he was so symptomatic. One, he had probably absorbed a lot of this anyway, so it wasn't going to be really helpful to decontaminate him. But two, I was really worried that he was going to aspirate. About 4 hours later, he started having seizures, which responded to some anti-seizure medication. But then he started getting worse. And about 10 hours post-ingestion, Dr. Powers really thought this bird was going to die. We went ahead and talked about him. He had his wings out, he had his head down, and he really wasn't even responding if you were talking to him or if you were trying to annoy him or anything like that. He wasn't really responding with that. So, what do we do next? Like I said, a lot of times we don't have a great blueprint in birds. But we do have other species that show similar signs to THC. And the species I'm thinking about is ferrets. Ferrets will do very, very similar things. They will start to go and have coma, like this bird was, and it definitely can be fatal. In dogs and cats, it is incredibly rare for this to be fatal, but in ferrets, it's actually fairly common. And we have done something called intravenous lipid emulsion. And this is essentially like a fat solution that we can give them. And it has been effective for ferrets. So we decided to go ahead and try it for this bird. So Dr. Powers placed a 24 gauge IV catheter in his right jugular vein. For those of you that are vets, this particular thing kind of terrified me. I don't know if I would be able to do it, but Dr. Powers actually talked me through it. It's super, super easy. If you can pull blood from the right jugular, you can actually go ahead and place an IV catheter. You just use some Hypafix tape to secure it. You wrap it lightly, and she said most of the time the birds tolerate this very, very well. Here's a picture of a sun conure that has an IV catheter in, because we do need that IV access in order to give lipids. We then went ahead and gave lipids with this bird. A lot of times we'll only continue for an hour, but in this case, we actually continued over several hours to see how he was going to respond. He had a very dramatic response to this. Within a couple hours, he went from looking like he was just about to die to standing up, looking around like absolutely nothing had happened. He was just kind of like, what's going on? Why am I here? This is weird. We didn't watch him for something called lipemia, which is where you get a lot of fat in your blood because he was just really, really small. We didn't want to pull that much blood, but it would have been possible in this with a bigger bird. All right. So he did really, really well. Within a couple hours, he was acting like he was back to normal. And he actually went home the next day. We went from a bird that we were pretty certain that was going to die to getting to go home the very next day. And 5 years later, he is still around happy, doing great. So really happy ending for him. We can see a lot of potential bad effects with this. So this is a really, really happy case, but we're not going to give this in every case for toxicity. It's not, unfortunately, a magic bullet. I would love it if it was like the universal antidote. Everything got better with this. But we can see some adverse effects from this. And there's a kind of a listing of everything that we can see. So we want to make sure that we get the right patient at the right time, showing the right signs before we consider this. And for the vets in the room, talking about dosing, this is what we generally do. We give them a bolus and then we start them on an infusion for 30 to 60 minutes. We want to make sure that we don't volume overload these guys because a lot of times they're very small and we're giving them a lot of fluids all at once. So knowing that we can see adverse effects, we're going to ask ourselves some questions. Is this likely to respond? So things that get absorbed by fat are more likely to respond. If it's expected to cause really bad signs, we're going to consider it. If there's no antidote, if I could just give them the antidote, I'm not going to do this. If it's going to interfere with other medications that I'm going to give them, I will not give them this. And we usually wait till these guys show signs. usually. Um, like I said, these guys Cookie Monster, and sometimes we don't end up seeing anything. I don't want to give them a treatment that might not be beneficial for them when they're not going to show any signs. And then we want to make sure that there's nothing with this patient that we can't give them lipids just based on their own background and medical history. This is not something we have used a ton in birds, but it has worked out well when we've done it. We recommended it in 19 cases for some different toxins. However, only 2 cases has actually been given. And part of the reason why, like I said, sometimes they cookie monster these, 5 of the 19 cases that we recommended that we could give it in, the birds only ended up showing mild signs or no signs at all. So that's why we wait for them to show signs, because we would have given it in those birds and we wouldn't, we could have had some side effects when they wouldn't have needed it at all. So the 2 cases we've given it in, one are the marijuana bird that we just talked about, and the second was a hyacinth macaw that got a medication called ivermectin. This hyacinth macaw was actually administered this medication. It's a medication that's sometimes used for parasites, and in this case, the pet owner thought that the bird had some parasites. So they gave them 3 clicks of this horse dewormer. And if you have ever been around horses or anything like that, you know that 1 click of this ivermectin dewormer actually treats 250 pounds of horse. So this hyacinth macaw actually got a 750-pound horse dose, which is a lethal dose for a macaw. She got 2 doses of lipids. She was able to stand and lift her wings after the second dose and actually went on to make a full recovery from something that very likely would have killed her. All right. Next up, we're going to talk about food. And one of the foods we need to really watch with our feathered friends are going to be avocados. All right. Avocados have a toxin called persin in it, and all parts of the plant are toxic. The leaves, the fruits, the bark, the seeds, everything like that. And there are a lot of reliable reports about seeing toxicity with avocados in ratites and citizens. So those are the types of birds that we're most likely to see toxins. Some birds may be much, much more sensitive to toxicity from avocados than others. We see a lot of variation in between species, and it makes sense that we would see different amounts of toxicity between birds. Okay. And this causes birds to have issues where their heart muscle starts to degrade, and it can also cause fluid buildup around their heart, which is really, really not great for them. We have had 318 reports of birds getting into avocados in the past 10 years, so this is something fairly common for them to get into. Just as an example of differences in species, I bet a lot of people have had avocado, like guacamole. I love guacamole. I've never died after eating guacamole. The reason that people, and to a large extent, like dogs and cats, aren't sensitive to avocado is because we don't digest the avocado fruit well enough to release the toxin. If we had a really, really great gastrointestinal tract and could really break things down and release the toxin because it's in the specialized compartment in the cells, avocado would actually be toxic to us as well. All right, more food. Chocolate. Chocolate is also toxic to birds the same way it is to dogs and cats. Most birds actually do like chocolate, but typically they don't eat enough chocolate to be an issue. So we don't tend to see the really severe signs like we see, especially with dogs, because they just don't tend to eat enough of it. Okay. We shouldn't let them eat it. Obviously, it can also cause things like stomach upset. Not a real great food for them to get, but very rare for birds to get enough of the chocolate that they have issues. If they do get into enough of it, it can cause things like high heart rate. It can cause hyperactivity and cause seizures too. The other food thing, and this is our big question, I talked about this a little bit earlier, was xylitol. And with xylitol, this is a sugar alcohol. You may notice xylitol has been an additive in human foods for a while. And the reason that xylitol has been added is it's a low calorie sweetener. Xylitol is actually all natural. It's made from birch bark or corn stalks. And it has a low amount of calories in it. It's been recommended a lot for by doctors for people with like type 2 diabetes because it doesn't spike your blood sugar. It also is recommended by dentists because it's actually really good for your teeth. It helps prevent cavities. It's not so great for dogs. We know for sure that dogs have issues with this. And what happens is they actually see xylitol as regular sugar. Okay, so their pancreas releases a lot of insulin. They said, oh my gosh, I just got a big meal. And when they have this insulin release, they're like, wait a second, I didn't actually get any calories. Okay. So this actually causes their blood sugar to plummet because they have all this insulin, but they didn't actually get any calories. And it can cause damage to their livers as well. So definitely very, very severe toxicity for dogs. We don't know for sure if it's an issue for birds or all birds or not. There is a pretty lovely paper that is in the literature talking about a nectivore called Cape sugarbirds. And these Cape sugarbirds were drinking out of a feeder that the well-intentioned person had made a nectar with xylitol. And a large number of these Cape sugarbirds, I think it was like 20 of them, died after they ingested nectar from the feeder. They did post-mortem exams on them, and the birds did die of seeing this low blood sugar. It's definitely possible that xylitol causes the same insulin release in birds, but also nectivores have a very high metabolic rate, and they were ingesting large amounts of nectar that had very, very low calories in it. So that could cause hypoglycemia as well. So it's a little bit of a question whether birds are really sensitive to xylitol or not. Either way, never make nectar for nectivores with xylitol in it. It will have the potential to kill them. Another toxin that we need to worry about are garlic, onions, leeks, and chives. And they have these sulfur compounds in them that actually react with red blood cell membranes, and it can cause the red blood cells to die, which causes anemia. It also causes these breakdown products to go and they have to be excreted through the kidneys, and it can cause kidney damage as well. So kind of two bad things that garlic and onions can potentially cause. We don't know the exact dose that is a problem for birds, but we do definitely know that it is a problem for birds. We have seen the same signs that we see in dogs and cats. We know that cats are much, much more sensitive than dogs. I would think birds would likely be a little bit more close to dogs than super sensitive like cats. Cats have very, very sensitive red blood cells. Right. So we can see stomach upset with them, and then we can see signs secondary to anemia. So they may appear very weak, they may be wobbly, they may not want to move around. They a lot of times will do the normal, I'm not feeling good, I'm going to be puffed up in the bottom of the cage thing that a lot of birds do when they're not feeling well. At the vet hospital, they may notice they have very high heart rates, that they're breathing very, very fast, and that their mucous membranes may be pale unless they're really pigmented. So if we notice that they have gotten into this, right away we can try to decontaminate them and get them from prevent them from absorbing those sulfides. If it's already been a little while since they've gotten into it and they're showing signs of anemia, they may need a blood transfusion. We may need to give them fluids to get their blood volume back up. And we can potentially give them some antioxidants to help protect the red blood cells as well. I'm going to talk really briefly about mouse and rat poison as well, because we do get a lot of calls with birds. Birds definitely will get into this. And the reason the birds get into these rat and mouse poisons is they are typically a grain-based, most of the time a corn-based block. So birds see that, and a lot of birds are going to be pretty excited about eating that. So there's three different kinds. The first kind makes them have trouble clotting their blood, and they are very sensitive to this. It takes very small amounts for them to start having trouble clotting their blood. We don't necessarily know exactly what the level of concern is for birds, but the nice thing is we treat this by giving them a vitamin. It's vitamin K. Some vitamins you can have issues with if you get too much of it. We're going to talk about vitamin D next, which is a problem. Vitamin K in general is very safe. So that makes me very happy. If we think that a bird might have gotten into this and they didn't, we can actually treat them with a vitamin K and it won't hurt them. So this is one of the few toxins that we have an antidote. It's very safe and very effective. Makes me very happy. How long we need to treat them depends on the type of anticoagulant they got into. So this is a time where bringing the packaging is very important because nobody wants to give their bird medications for 30 days when they don't need it for that long. One of the other rodenticides is vitamin D or cholecalciferol rodenticide. Again, we don't know exactly how much it takes to be an issue in birds, but we know that it definitely does happen. And what this does is this causes birds to have very high levels of calcium and phosphorus in their blood. And then they can actually take that calcium and they will start laying down calcium in tissues. And one of the big things that we worry about is they start putting all these calcium deposits in their kidneys and they can actually go into kidney failure because of that. And then the last one is going to be called something called bromethalin, and this is a neurotoxin. Bromethalin is particularly dangerous, and most vets hate it because we can't treat this once they start showing signs. There's no effective treatment. So we want to make sure that we see these guys early. We're going to do crop lavage. We're going to do activated charcoal because preventing toxicity from bromethalin is all about making sure that they don't absorb it in the first place. We don't know exactly how much of this it takes to be a problem in birds. We do have what's called an LD50, and an LD50 is a lethal dose. This is where 50% of the animals that got this dose die. And we see that quails are very similar to dogs. So most likely, at least quails and potentially other birds would be about as sensitive as dogs. All right. Next up, kind of an interesting one. We will see some people use glue traps, these sticky traps for mice and rats. Most of the time, this is nice. These things are non-toxic. If you have to use something, this is not a bad option. There are some issues with the humane aspect of this. You need to check these very often and free these mice, but that's another thing. But as far as other patients in the house, this isn't a bad option. These are going to be glues. They're on either a paper or plastic backing. Sometimes they'll have this little cardboard tent on them. If you are going to have one in the same house as a bird, I would recommend to get one of these with a cardboard tent. And the reason why is birds will find these. All right. They are very interested in them. Sometimes they will chew on them, nibble on them a little bit. I can't tell you why, but every case I have had of a bird versus a glue trap, a bird has ended up on its back, upside down, stuck to the glue trap. Both of its wings just completely stuck. This can cause irritation to the skin. It can pull out some feathers, so we have to be aware of that. One of the things that I get really worried about is sometimes these birds will get exhausted struggling, especially if you don't find them right away. So I'd be very careful if you use glue traps. Make sure that they're in a place that the birds have no access to ever, because these can be pretty serious for the birds. If they do get into a glue trap, we can decontaminate them. And what we will do is we'll remove that sticky glue with something like vegetable oil. All right, so we'll do very, very small amounts. If they are stuck to the glue trap, don't pull them off of the glue trap. What you'll do is you'll actually put little amounts of vegetable oil around the edges where their feathers are stuck. You'll gently massage that into the feathers and you'll start rubbing out that sticky residue. The glue trap will start coming away from their feathers. And then when you get the glue trap off, you want to go ahead and bathe the bird with that dish soap to get all of the vegetable oil off of them because we don't want them preening that and ingesting that. That's not good for them either. And then we just want to make sure that we keep the bird warm until it's fully dry so we don't chill them. All right. And then last but not least, I'm going to talk about inhaled toxins for birds. Okay. This section is a little bit sad, but we have a lot of good information at the end. So, one of the most concerning things for birds is going to be polytetrafluoroethylene or Teflon. I'm just going to call it Teflon. I don't usually call things by their trade names, but polytetrafluoroethylene is a mouthful. Right. So Teflon, if you're looking at like Teflon pans or something like that, under normal circumstances, it is inert. Okay. So, if we have a bird that chews on a Teflon pan, I'm not worried about that bird dying. It's not great for the bird. I wouldn't let them, obviously. But I'm not worried about them developing life-threatening signs from that. Where we see issues is when the Teflon is heated. We can see these polytetrafluoroethylene fumes, these Teflon fumes, and that is what is really, really a concern, especially to birds. We can see signs in other species as well from them inhaling this, which tells you how bad it is for birds. If you've ever heard the, term canary in the coal mines, the reason they would bring canaries down into coal mines is that birds are going to be much more sensitive. They're going to show signs with inhaled toxins before any other species would. So if they saw a bird starting to go into respiratory distress, they knew that they needed to leave right then. Okay. So the birds are going to be even more sensitive. If this is a problem for other species, we know that this is going to be a huge problem for birds. And what this happens is actually works on their heart muscle and it causes them to have irregular heartbeats. It works on their lungs and they get all congested and full of fluid and they can actually go into heart failure from this as well. Talked about this before. I'm going to say it again because it's so important. We know that those environmental conditions and ventilation can really vary in places in the house. So don't assume that the birds next to this are going to be the birds that are going to be most effective. In ASPCA data in the past 10 years, we've had 38 Teflon inhalation cases. Of those, 8 of them have died, 1 of them lived, and we don't have outcomes for the rest of them. So definitely can be very, very deadly with birds. Birds that have underlying heart disease or respiratory disease, so if you have any birds with any chronic respiratory issues or anything like that, they're going to be more sensitive, so we're going to be even more worried about those birds. So, how hot does Teflon need to be heated for it to be a problem in birds? Because it's not every time you put a Teflon pan on your stove. We have seen birds that died at when a Teflon pan was placed in an oven. I don't know about you, but my mom always used to store all the pans in the oven. Somebody didn't realize that there was a pan in the oven. They heated their oven to 325 and birds did die from that. 350, really common baking temperature, so that definitely could release those fumes. There's some birds in Missouri that were put under Teflon coated light bulbs and they experienced respiratory issues and died from that as well. DuPont, who made Teflon, did some experiments on birds, and at 536 degrees, they noticed toxicity. So they actually warned people about this before they ever put Teflon out, that it was a problem for birds. If you have a Teflon coated pan and you heat it for 8 minutes on a conventional stovetop under high heat, it'll get up to 750 degrees. At that point, it typically starts smoking, and like humans will have issues with it as well. So where we see most issues is if something is being preheated in the oven, or if you have a pan that has nothing in it, or if it runs dry. One of the cases I can think of, a pet owner was making pork chops and had them braising in liquid. They had gotten distracted by the doorbell, went to help a neighbor, came back, and all of the water had evaporated, and they actually had Teflon fumes. So, what are we going to do? We're going to do our inhalation decontamination. So we're going to move them to fresh air. We're going to move them completely out of the house. If it is a day like today where I have tons and tons of snow coming down, I am going to immediately move them someplace warm. So I'm going to reach out to my neighbors or something like that. Okay. I am going to recommend supportive care for them. So if I do have birds, they are going to need to go into the vet hospital. We may need to give them oxygen. We do want to minimize stress. We may give them some medications to help get the extra fluid off of their heart and lungs as well. Unfortunately, a lot of birds that are exposed to Teflon may present and they've already passed away. All right. When do we not worry about Teflon? We do not worry about Teflon in stain-resistant fabrics. A lot of times couches will actually be coated with Teflon to help prevent stains. They are not a concern under regular circumstances. If you happen to, and this is a joke, if you happen to light your couch on fire, the Teflon could be an issue, but I think you have a lot bigger issues with smoke inhalation at that point. There are also household cleaners that say that they contain Teflon on them. That is not the Teflon that we are talking about here, so they are not a concern. You can see Clorox here. They have bathroom cleaned with Teflon. Talking about other inhaled toxins, we know that those birds have that highly efficient respiratory tract. They exchange gases really, really well, so they are very sensitive to inhaled toxins. We have seen issues with household cleaning chemicals, birds inhaling that and going into respiratory distress. Air fresheners can be an issue. We've actually had 8 cases where birds have died after being exposed to air fresheners, so be very, very careful. I wouldn't recommend using air fresheners around birds. And then self-cleaning ovens as well. We can see issues with that. We do have cases of birds that got into inhaled essential oils as well. We have 3 deaths with those birds as well. So definitely inhaled toxins are a very big concern for birds. Like most things, I want to talk about how do we prevent this. So if we have something that we know it's going to be in the air in the home, how do we use that safely around our birds? Um, we want to plan ahead prior to using anything else that might be an issue. Okay, so if I have something and I'm worried that's going to be an issue, I'm going to reach out to my veterinarian. I'm going to see what they think. If we determine that it could be an issue, we need to remove all the birds from the area before we use it. If we have to use it, if we don't have any alternatives, we need to remove all of the birds. We need to air out the area prior to reintroduction. And we need to make sure that it's safe and that all of everything's off gas, that it's no longer in the air before we return the birds to that area. All right. All right. What questions do we have? I see that there's some comments on glue traps that I do not disagree with. That might be the first place for us to start.
I thank you. You've given us so much to think about. And yes, we have some questions, and there's always more to come, I'm sure. Um, you piqued my interest when you talked about activated charcoal. Is that, I wasn't clear, is that something we can do at home? And should we be prepared for that? Like have it on hand?
Oh, that's an excellent question. So the activated charcoal I'm talking about is a medical grade activated charcoal. This is something that's really only going to be available to your veterinarian.
Okay.
Um, it's a great idea. It can be very difficult to give birds activated charcoal as well. A lot of times we'll actually gavage the charcoal with them. So it's not generally something that I recommend pet owners doing at home. If you have somebody who's really experienced, it could be, but it's not an every time thing either. We can see some adverse effects with the activated charcoal, so we want to make sure it's a circumstance that we really need it. So usually it's reserved for using at the veterinary hospital.
Okay, so it's not something we should have on hand. I saw one of my favorite brands, Now Foods, actually sells it in capsules, and I was thinking, should I have it just, because when something happens, you don't have time to go figure it out. You need to be ready. So,
Absolutely.
yeah.
Anything you're going to get over the counter like that is actually, in most cases, a homeopathic remedy. A lot of times it's marketed to like relieve flatulence, and it's not going to have the amount of absorption that we need it to. Medical grade charcoal actually is a lot of times is made from like wood or that sort of thing, but it undergoes this very specific process, and it makes this really complex pore structure in that charcoal, and it has all of these little places for the toxins to like get stuck in. And that's why it's a lot more effective than what you would get over the counter.
Okay, good. So it's not one of those things we need to have on the shelf just in case. Okay. Um, Tell us more about when if something happens and people need to call, they call the ASPCA. What happens then? Is there like a charge? Do you keep the records? How does that work?
Absolutely. And that's a great question. I saw we had a couple questions here in the
Right.
Q&A about how calling poison control works.
Yeah.
So we do have a fee for our service. And what that gets you is, you're going to talk with a toxicology expert. We're going to get all of the history. We're going to talk about your bird. We're going to let you know what the concerns are. We're going to let you know if there's anything you can do at home, if they need to go to the veterinarian, if they need to go to the vet, we'll say, hey, is there anything you should do before you go in to help with decontamination or anything like that? When you get to the vet hospital, your vet actually can call us, and most every vet does because, especially with birds, a lot of times, we have a database with over 5 million cases in it. So we have a lot of cases of these things. And sometimes we say, oh, yeah, we've had 138 cases of this, and we can tell you exactly what's worked and what hasn't. So we'll talk to the vet. All of the follow-ups are included. If you need to call us 20 times about this case, if your vet needs to talk to us, the bird that we had, I talked with Dr. Powers multiple times. As things changed, we changed the treatment plan. So that's what it gets you.
And so do you keep that information accessible? So if the person needs to call back or follow up, that it's, you know, part of your database, or
So it's
how does that
always
work?
part of our database. If you let us know your vet's information, we'll send a copy of the case report, so they'll have it for your bird's medical record at your vet as well. Um, we don't have at the moment, we're getting a new system and I'm really, really excited about this. At the
Mm,
moment, the cases aren't linked. So if you called us, 10 years ago and you call us again about your bird, one of the beautiful things about birds is how long they live. We aren't going to have those cases connected. We can look up the old case if it's relevant to the current case, but they're not connected at the moment. We're hoping in the future we can actually have those connected. But at the moment, thankfully, most people don't have to call us multiple times, so we don't have those individually logged for the birds.
And Bonnie also wanted to know, do you stay on the line with the person while they're doing whatever needs to be done at home before
Yeah.
they head to the vet?
Most of the time we don't. Most of the time we're going to say, hey, these are the concerns. This is what I need you to do right now. But we've found that it's most effective and it's the best use of everybody's time and effort if we have you completely focused. Like if I say, hey, we need to give this bird strawberries, probably best for you to have your hands free and to be able to fully focus on this. If you have questions, if you're having any trouble, like my bird won't eat strawberries, what do I need to do? All you need to
Mm,
do is give us a call back and we'll change our plan as we go.
that makes sense. Um, Recently, Dr. Scott Eccles, who does a lot of research with CT and MRI, et cetera, he told me that he's seeing an unbelievable number of birds, mostly during necropsy, that have metal that was not detected on radiographs. Just, an explosive number, in his opinion. Are there signs? Are there, like, do birds have seizures? Is there anything that people can do to know that maybe that is the issue? Because so many toys, have bells
Yeah.
and flappers and
Yep.
terrible metal things. Yeah.
Yep. The signs are really going to vary depending on what type of heavy metal is in the metal. One of the things I would recommend doing, especially if you're buying toys that have metal from overseas is go to one of like the hardware stores or anything like that. A lot of times they'll have lead test kits, and you can actually test those before you give them to the birds. They're super easy to do. It's like a little swab, and you get a color change. In most cases, it turns like bright pink. So there's no question about this. If you have honestly anybody in your household, including dogs and cats and small children, this isn't a bad thing to do to see if that goes. I personally have used it on like my ceramic dishes and stuff like that, and some of them I've been surprised to learn actually have lead in them. But it can cause a variety of different things. Some things like zinc can cause them to it can cause really severe damage to the red blood cells. So you may see signs similar with anemia. They may be very weak, that sort of thing. With lead, you can potentially see seizures. It all depends on what type of heavy metal that their things are contaminated with, unfortunately.
Are there other major symptoms that go along with metal toxicity that you can think of?
They can do pretty much anything. If you get something like arsenic, it can cause horrible. A lot of times, the first thing you see are horrible signs of gastrointestinal upset. You'll see them regurgitating. You'll see blood in the feces. You'll see, all kinds of things like that. It can cause signs with the skin and the feathers and everything like that. It can really do most anything. Unfortunately, there's not like one clear sign that says, "Oh yeah, this is definitely metal," unfortunately.
Okay. Um, Somebody wanted to also know about taro, the ant stuff. I guess
Hmm.
that would have a similar reaction as some of the other poisons. I have a very noisy foster cockatiel. I apologize. I keep turning my audio off. Yeah. Tell us what you think about taro.
About taro? Yeah, absolutely. So Taro is a company that makes a whole bunch of different types of insecticides. The sticky stuff that we were kind of talking about is most likely boric acid. This is where having that packaging is so key, because we can see different signs depending on what that active ingredient is in there. With boric acid, a very small amount is not going to hurt your bird. So if your bird, happens to get into one of those, a lot of times there'll be like these long plastic traps, and if your bird happens to, puncture one of those, we're probably not going to see real severe signs. We can see some stomach upset. We're probably not going to see a lot more severe signs with them. It kind of depends on what the active ingredient is in that, how concerned that we need to be.
Have you ever heard of using Manu clay or cilantro or any of those other chelation products for detoxing? Has any of that ever come up?
Um, Sometimes it does. There are some clays that do have some evidence and some backing with them. Part of the challenge is a lot of them haven't been really scientifically tested. I know some clays do help for things like paraquat, but I don't know necessarily if it's going to help for things like ibuprofen. So a lot of times we will stick with things that we know for sure works. Although certainly. I'm never going to be opposed to giving your bird a little bit of cilantro if they like it. Things that have very low risk, I am always game to try. It certainly couldn't hurt. Cilantro has a lot of good health effects. So I certainly wouldn't be upset about trying something like that.
Um, Leslie had a really good question about, the products we buy for our kitchen or
Hmm.
any kind of appliance, actually. The warnings are not always so easy to understand. How do we just differentiate what's okay and not okay?
And that's where things get so difficult for
Hmm.
birds because the this world unfortunately is not built with birds in mind. I would love it
Right.
if all of our pets, if we had appropriate labeling, but a lot of times it's going to be very, very difficult. So a lot of times we just kind of have to err on the side of caution with that. Sometimes you can contact the manufacturers, and a lot of times that's going to be one of your best sources of information. They may not have information but another manufacturer might. So I would definitely recommend that. If anybody does have any questions, always feel free to reach out to your vets, or reach out to Poison Control. That's why we're here, and we're more than happy to help. But sometimes, unfortunately, with the way things are labeled, we're not going to have a great idea either.
Yeah. Sometimes we have to write the manufacturer and we don't always get a coherent answer,
Yeah.
but sometimes we do. So that's,
Yeah.
it's
Yeah,
worth
we do that.
trying.
Yeah, for sure. We do that a lot with manufacturers. Hey, you don't have a list of inactive ingredients. You don't have a list of this. Can you give this to us? And a lot of times we're pleasantly surprised that they are pretty forthcoming.
Mhm.
Sometimes they can say, well, that's proprietary, but in this case, I can tell you because we are worried about seeing signs of toxicity and they'll be fairly forthcoming. Sometimes you have to call multiple times and get a hold of the right person if you've got a pet, a lover on the other end of the line. Sometimes they'll bend the rules for you. We have hundreds of thousands of things in the database that we have gathered information on and sometimes it does require a lot of those calls.
I'm sure they're more responsive to an organization like you at the ASPCA than they would be to an individual too. So that's probably helpful.
It is,
Um,
yeah.
I'm curious, what is the most common problem you get calls about for birds?
Honestly, it's plants. Birds really like to get into plants. They're in the house with them. They're pretty ubiquitous, and birds like to nibble on them and just taste them and see what's going on. Is this food? Is this something I need to be worried about? So we get lots and lots of calls of birds deciding to sample plants.
And yet you give them a leafy green and they don't want to eat it, right? So
Yep, yep, for sure, for sure.
um,
Needs to
somebody
be their idea.
somebody wants to know about moisture absorber boxes. I don't really know what that is. You probably
Hmm.
do.
Yeah, so some of there'll be these a lot of times they're these plastic packages and they're designed to absorb excess moisture and they will have calcium chloride in there. Um we're asking, is that treatable in birds? Biggest concern that I have with those, I haven't had a lot of reports of birds, of this being really an inhaled toxin. I'm never going to say never when it comes to birds about being sensitive to something, especially if they're in an enclosed area. Ventilation is really key for a lot of these things not being an issue. Where I worry about calcium chloride is a lot of times if they ingest this, it definitely can be caustic to their mouth. We can see sores, we can see burns, that sort of thing. I think if they were in an enclosed area with this, we could potentially see some irritation to the respiratory tract as well. So if you have a bird that you suspect has been exposed to this, that you are seeing some signs, or if they were, in a really enclosed area, like they got trapped in a closet for a prolonged period of time, more than a few minutes, probably not a bad idea to have them checked out at the vet hospital because we do know birds are so good at hiding respiratory signs just to make sure their lungs sound nice and clear. We're not seeing any burns in their mouth if they got into it or anything like that. With a lot of these respiratory toxins, it's really just supporting them through, trying to keep up their
Oxygen.
oxygen levels, that sort of thing, to make sure that they can kind of clear this on their own, unfortunately.
Because it can go so fast. Um, what about unvented fireplaces? Do you get calls from people with have had that problem?
We do sometimes. If you get incomplete combustion, is what we call it, that definitely can be an issue as well. So anything that you are burning, if it leaves some of those byproducts, some of those gases, it definitely can be an issue for birds
Mhm.
as well, especially if they're close to it and they're inhaling it.
I worry for people too. Unvented fire, I mean, any kind of smoke inhalation like that can't be good for our lungs. So Yeah. Somebody wants to know about DMSA for toxicity. I know that's a pretty common thing that happens at the vet offices also, right?
Yeah, yeah, you can potentially use DMSA as a chelator. I don't know that I have experience necessarily using it with birds. A lot of times these chelators anymore, unfortunately, especially post-COVID, have been very difficult to get our hands on.
Oh.
So that can be an issue as well. I think there are some cases out there where it's been used. This is something that I definitely need to dig into a little bit more.
Mm-hmm. Um, and Nancy has a really good question about vomiting versus regurgitation. I know I've had that question myself sometimes. It's hard to tell.
Yep.
What are the distinguishing factors that you think?
So when we think about vomiting versus regurgitation, vomiting is kind of an active process. I'm sure everybody in here has probably vomited at some point. You tend to do a good bit of retching. You kind of know that this is coming up. Anybody with cats, at 3 a.m., they always choose to do this. Regurgitation, a lot of times it's a more of an involuntary reaction. A lot of times they'll seem surprised. You won't see that retching. They'll just all of a sudden just bleh. So that's more of regurgitation. We do have some species that can't vomit.
Hmm.
We know that dogs and cats can vomit just fine. Pigs can vomit. But what I usually talk about with species that can vomit versus can't, it is all exotics cannot vomit except for ferrets, and all livestock except for pigs. And that does include livestock includes our chickens, exotics includes our birds. So birds can't vomit. So if you see them bringing up something, they are regurgitating.
Mm-hmm. Sometimes it seems like regurgitation could be part of that inappropriate mating response, or
Mm-hmm.
maybe they have ganglioneuritis and they can't digest it, or but it seems to me sometimes there's a little bit of not very often, but I've seen more profuse, kind of more liquidy, like something can't, like maybe there's an obstruction and they can't
Mm-hmm.
swallow, and all of a sudden they haven't made it come back up. It just can't go down, basically. So,
Yeah, and sometimes you'll get like stasis where things aren't moving through the crop like they should, or you'll overfill the crop. That's why I was saying with the charcoal, we have to be very mindful of how much we can put in the crop, because they will regurgitate if you overfill it.
mm-hmm. And we worry about those happy huts and other cloth related things that conures are especially known for swallowing and getting obstructions. So,
Hmm.
yeah. So in that case, you're not always sure, is this regurgitation because my bird loves me, or is this like I can't swallow because I have an obstruction? Yeah. So,
Yeah.
well, you have given us so much to think about today. I'm sure I'm going to go back and watch this again so I can have it, my brain muscle will remember it when the moment happens, because I'm sure when something happens, we're all kind of in a what do I do panic mode. And that's so is there like a number at the ASPCA that you can tell us people could call, or
Absolutely. You know what I'm going to have to do, and I notice this with vets all the time when they call. I'm gonna have to look it up because
oh
I have our follow-up phone number memorized, but I don't have our main hospital phone
yeah,
number
like Bonnie was
memorized.
just saying, she put it in her phone. I think that's very wise to be ready. That's a very
I
good idea,
definitely appreciate that. Um,
because you've given us a lot to think about, not just for birds, but dogs. And a lot of us have other animals, and they have the same
Absolutely.
potential problems, right?
Absolutely. So the phone number, if you guys are interested, and you can just Google this as well, is it's 888
Okay.
426
Okay.
4435.
4435. And are you the one that is always dealing with the toxicity issues?
We have over 150 veterinarians and vet techs who
Wow,
take these cases. Like I said, we've done over 5 million cases. So you might get me, you might get somebody else, but
that's
there's
amazing.
always somebody on the line 24 hours a day.
Wow, what a robust system. That's fantastic. Because it always happens. The accidents and the problems always happen at the most inconvenient times, right? So
Yep.
good to know there's 24/7 help. That's fantastic. Well, it was a privilege and an honor to have you with us today. Thank you so much. And for all you do for animals. I'm sure you see the best and the worst of things. So, yeah,
Thank you so much. It is always an honor and a privilege to talk with people who are really excited about their pets and about keeping them healthy and safe. And this is one of the most rewarding parts of my job. If I can prevent any animal from suffering, that's definitely the most important thing.
we agree. I mean, education is everything. If we can prevent the problem, and not our birds don't suffer at you know, they don't suffer at I'm not saying that right. We don't want them to suffer at our
Yeah,
expense. Yeah,
absolutely,
their
absolutely.
expense. Yeah.
Thank you for Melissa
Thank you.
for putting the phone number in the chat. I really appreciate that.
Very good. Awesome. Well, I hope everybody has good holidays, no accidents, no toxicities. Stay away from the poinsettia. That's one of the big ones this time of year, right? You get a lot of calls about that.
We do get a lot of calls about that, and I'm actually glad that you brought that up. So, last final tidbit here. Toxicity with poinsettias is actually very overblown.
Oh,
So there is a latex sap, which can be a little bit irritating, but in most cases, we just see mild stomach upset. So I definitely have had calls about birds and poinsettias, and usually we don't see much of anything very exciting with them. So don't worry too much if your bird happens to chew in your poinsettia. Definitely reach out to your vet, but in most cases, we don't see anything too severe.
oh, that's good. I worry about this time of year too. A lot of candles, ornaments, getting it, flying into the Christmas tree and eating metal and plastic and all kinds of troublemakers there. Yeah. So
Yep,
this
for
time of
sure.
year, it's good to be extra vigilant. Yeah. Okay, everybody, thank you for joining us and being avid learners. And I hope you will join us again next year. And our next event again is January 10th. And best to you, Dr. Stern. Thank you again. We're so
Thank you.
grateful. All right, everybody. Happy holidays. Thank you. Bye.